David Atwell, a keen tennis player, was treated for kidney cancer a month ago. 3 days later, he was back on the courts. He's taking part in the clinical trial of a new way of destroying tumours, without having to resort to painful invasive surgery.
Well, I arrived at the hospital at 7 o'clock in the morning after no breakfast. The procedure, I think, only took an hour or so, hour or two. It seemed to be shorter than expected. I was kept in overnight, was back home the following day, and I might add back on the tennis court in about 3 days.
This is how David was treated. It's an ultrasound machine from China, which has been used to treat cancer patients in the Far East for years. Doctors at the Churchill Hospital in Oxford are hoping it will prove successful here too. They're trialling it in the treatment of kidney and liver cancer.
High Intensity Focused Ultrasound is a way of treating tumours in the body without the need for any surgery. We're all familiar with ultrasound. When you're doing an ultrasound of the body, or people who are pregnant and so on, you get this image. But also what happens is at the focal length, you actually get a little bit of heating. Now, if you turn up the power by 10,000 times, you can actually create a burn in the body.
A conventional ultrasound finds the tumour. Then high-energy ultrasound beams target and destroy it. The body naturally absorbs it over the next few months, leaving a small amount of scar tissue. This cube of transparent gel shows how the machine works.
Every time you fire it, you get a little lesion, which is about the size of a grain of rice. There we go. And in this block of gel, it appears as a little white blob, which then disappears afterwards. And the temperature there is about 80 degrees centigrade. When you're doing it on a patient, you just array those little grains of rice next to each other in 2 and then 3Ds, and in a sense paint out the tumour.
One of the inventors of the machine is Professor Feng Wu, who's had great success with HIFU at home.
In China, we started to treat people in 1997. Since then, we have treated 30,000 patients.
The team hopes this technology will one day be used to treat many different types of disease across the UK. Here at Oxford, they've already treated 140 patients.
So I think that as the technology improves over the years, it has a huge future. I mean, I think this is the future of surgery.
For patients like David, it offers the hope of a cure without invasive and painful surgery. He still has to have his tumour surgically removed, just to check the HIFU worked. But if the trial proves successful, then in the future, others won't.